Yeah, because a lot of the fundal massage is going inside also.
Yeah.
So, well, she can put her hand in, don't you? Because I couldn't.
Actually, I can't.
Oh, really?
It's really wide right there.
So do you normally fit your hand all the way in?
Yeah.
But I can reach.
If you need
I can't
to.
reach this. I mean, if I
Okay.
need, yeah, if you're gonna
Okay.
manually extract or,
Yeah.
but no. I think I should be able to reach a little bit further though. So I think if it was wider,
Okay.
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 that would be helpful.
But a baby's head is 10 centimeters, so it's usually about
Right.
that far around. So you can, most hands will fit in there after delivery if you need to for an
Yeah.
emergency.
And at first,
So-
oh, sorry, go ahead.
No, go
No,
ahead.
no, I'll talk when it's my turn.
So I'm just supposed to be demonstrating fundal massage.
Uh-huh.
Okay. So oftentimes when it's not contracted, it's kind of hard to find it. So kind of searching for it and bringing it down and then really giving the force.
I don't know if I'm controlling this, but I don't know if I'm controlling this the right way.
I don't know.
Do you feel like the firm
I mean, I feel like
uterus
it's
underneath?
Yeah.
Does-
Right about here, and then it's firmer down here, but you can feel it still
If
squishy up here.
if you were to compare this to a living person, what do you think is the biggest thing that this is not is very inaccurate in portraying?
This phone right here. No. I don't know.
By the bone, you just mean like the iliac crests?
One of the main landmarks I use when I'm doing fundal massage is the suprapubic bone. And because you want to, if you're really expressing hard on that, you want to put pressure against the suprapubic bone so you don't evert the uterus. And so that's an important landmark that I would include in a teaching tool.
Okay.
I almost feel like it's too high.
What's too high?
The uterus is?
The iliac crest right here.
Compared
But
to vagina.
that's what I was, yeah.
Oh, okay.
But otherwise, no.
So that was something we were thinking about actually. Is we have a hip, a pelvis, and then we were going to embed a pelvis in this foam
Excellent.
and see where that
That
how
would
that
be
works.
Really
That would be
interesting.
very,
And then
yeah.
encase it in latex and then have the opening.
Yeah.
Yeah.
I think that's a great
That's
idea.
something that
That actually is
That
really
would be
good.
very good.
Okay.
So, in terms of how the uterus feels as it contracts, is that accurate or ice bag?
Like, I guess. I mean, it depends on, like, sometimes a woman responds really quick to uterine massage, and sometimes it seems like you just have to push on it forever.
Does
before
the
it
shape of
gets
it
good.
feel like it should, or is there?
I think it feels a little small to me.
Okay.
I have a question about that. The like adipose tissue and the fatty layer in the skin. Do you think this is the thickness would be an accurate thickness, or do you think the user would benefit from more like layers that we could potentially like Velcro on top for like thinner women or thicker women that would ultimately lead to a better like teaching device? Or do you think this would feel like most women? How important role does fat play in this?
I mean, it plays a big difference if a woman's like 400 pounds.
Okay.
You
It
can't
does.
really find it,
Uh-huh.
you know.
It's really.
Yeah.
But in Africa, most of your women are probably going to be pretty thin, I would imagine.
Okay.
So this is probably,
Yeah.
I mean, right? If like the midwife or
Yeah.
You
the
would say
patients
you-
are probably a lot thinner, you know,
Mhm.
just from the malnourishment. So I think you don't probably want it too thick if your primary target is
Okay.
Africa.
Well, one thing they said is that while malnutrition is an issue, obesity is also a problem.
Oh, okay.
So from just not eating
Really?
good food,
Okay.
yeah.
Okay,
And so,
maybe that would be a good idea,
Right.
then, just so they can get used to.
yeah,
because
that was why we
it's,
originally started using this, because we wanted to have a fat layer
yeah.
underneath
And like
that.
different fat layers, then we
Yeah.
decided to scrap that whole thing and probably just make different layers of this.
Yeah,
That
I think the
would-
Velcro
this
would be a good
accurate,
idea.
Yeah.
Because, like she was saying, if somebody is obese, it is much more difficult to find their fundus and to really get a good massage going because they have so much adipose in the way.
Hmm.
So, I think that's a good idea.
This is exciting.
I know, I was so excited when Zara emailed me. I was like, that's so cool. Good idea.
Okay. Thank you so